The way we are born and the way we give birth matters. Global health experts agree that how women are treated during childbirth can affect the health and well-being of the mother, child, and family. A woman's birthing experience can empower her or scar her for life. How a woman is supported through her pregnancy, labour and birth can and does impact on her postnatal recovery, adjustment to motherhood and her self-esteem for years to come. Therefore, care providers have a responsibility to be sensitive to the woman's emotional, cultural and physical needs. The World Health Organization says that we need to go beyond survival to see more women having positive experiences and access to respectful, quality maternity care. It is not an illness to have a baby. Pregnancy, labour, birth and breastfeeding are normal physiological processes, and there should be no intervention in that process without a valid reason. Technological advances and surgical skills used appropriately can save lives. However, without valid indications, routine use can transform childbirth from a normal biological process into a potentially harmful medical procedure. This has resulted in two extreme situations existing in maternity care: too little too late and too much too soon, where in some settings women are receiving care too late. In other settings, women receive too many interventions that they may not need too soon. Unfortunately, this is a common experience for many Australian women and their families. Due to the normalisation of the culture of technocratic and detached care, it is likely that health professionals are unaware that they are not providing respectful care. The most effective maternity care system requires professionals to combine respect, kindness and compassion with their clinical skills. These elements of care are often seen as lesser in value and even neglected, but are essential for better pregnancy outcomes. Embracing this view will mean letting go of entrenched, custom-based practices, adopting reliable evidence, and providing relationship-based care. Woman-centred care describes care which is responsive to an individual's personal circumstances. Providing woman-centred care is being aware of a woman's total well-being, considering her relationships, values, beliefs, and the need for self-expression. Respectful maternity care, as defined by the World Health Organization, is care organised for and provided to all women in a manner that maintains their dignity, privacy and confidentiality, ensures freedom from harm and mistreatment, and enables informed choice and continuous support during labour and childbirth. The World Health Organization has identified 7 domains of respectful maternity care: dignity and respect, communication and information, autonomy, confidentiality, physical comfort, support during labour and birth, and appropriate care. Dignity and respect. The behaviours and attitudes of professionals are fundamental to respectful care. They must show respect, kindness, understanding, tolerance and compassion through their words and actions. No woman or newborn is subjected to mistreatment or harm. Every woman has the right to equal and effective protection against discrimination. This means equal treatment without discrimination regardless of race, ethnicity, culture, religion, age, weight, sexual identity and gender identity, socioeconomic status, or marital status. Communication and information. Healthcare providers are responsible for working in partnership with women. Health outcomes are better when women are actively engaged in their care. Working in partnership is about treating a pregnant woman as a competent adult and respecting her as the lead in making decisions. Healthcare professionals are responsible for making information transparent. When recommending an intervention, they have a legal obligation to inform the woman in a balanced, unbiased way of the risks and benefits of all options available. The woman is entitled to make an informed decision, that is, the choice to accept the recommendation or decline it. Autonomy. It is the right of every human to have control and authority over their own body and decide freely and responsibly on matters related to their health. Many interventions in pregnancy are medically unique in that they may harm the mother, not primarily for the promotion of her own health, but for the benefit of the baby. Some health professionals, when they believe the fetus is at risk, consider that the woman no longer has choice. Coercive control is used so that women receive care that the maternity services consider to be in her best interests. This approach relies too heavily on the care provider's context. In their paper, Canadian Care Providers and Pregnant Women's Approaches to Managing Birth, Minimising Risk While Maximising Integrity, Hall, Tompkinson and Klein state that some care providers talked about pulling the dead baby card when their need for control and power was more important than women's control, whether or not the baby was at risk. Privacy and confidentiality. There are many ways a woman's right to privacy and confidentiality can be upheld, including only exposing minimal body parts, ensuring no one can overhear conversations, limiting the number of students, and keeping personal health information confidential. Appropriate care. For maternity care to be woman-centred, efficient and cost-effective, the aim should be to deliver appropriate care in the right place, at the right time, with the right health professional. Risk factors have come to be seen as dangerous in themselves, even when they pose little threat to the women who have them. With limited reliable evidence making clear who is normal and who is at high risk, there is a tendency to err on the side of caution. The line is drawn so that the maximum number of people are labelled at risk and therefore become candidates for inappropriate, unnecessary and potentially harmful interventions. Continuous support. Every woman is offered the option to experience labour and childbirth with the companions and health professional of her choice. Insufficient, untimely and unempathetic care makes women feel abandoned when they are most vulnerable. Abandonment is refusing care when a woman will not consent to the health professional's preference. Abandonment is a form of disrespect and abuse. Physical comfort. Respect and support the woman's choice for comfort and coping strategies. Women must be enabled to choose the most comfortable way to labour and birth. Ultimately, women need health professionals on tap, not on top.